everyone, I am Dr. Anshu Mishra. I am a board certified cosmetic and plastic surgeon practicing in Dubai. And today in this video, I am going to bust a very common myth associated with the breast implant surgery. Women, they are often concerned about whether my breast implants are going to look fake after the breast augmentation procedure. There are two factors that should be taken into consideration in order to make the breast implants look natural. First is the size and shape of your natural breast tissue, and the other is the size of the implant. If the existing breast base is smaller and you select an implant that has a wider base, then in this condition, the results are going to look fake. It is important to do certain measurements and certain assessment prior to the surgery in order to decide the appropriate size of the implant. So we use calipers to measure the base of the breast, which helps us to guide about what base of the implant should be selected. Implants are also available in different projections. For the same volume, there can be a low profile implant, the moderate profile, high profile and very high profile implants. Depending on the existing laxity of the skin, which can be assessed by the anterior full skin stretch, depending on the body frame and the other measurements which will be done by the plastic surgeon, the appropriate projection should be selected in order to give a natural result. Another factor that affects that how the breast augmentation results are going to look also depend on where the implants are placed, whether they are placed under the muscle or above the muscle. If the patient is thin, there is not adequate padding in the upper pole and the thickness of the subcutaneous tissue is less, in these conditions the implant can be placed under the muscle to give a good coverage in the upper part to give a smoother transition. The disadvantage of putting the implant under the muscle is that whenever the chest wall muscle contracts, the implants will move. Those who have adequate tissue in the upper pole and have adequate thickness, in these patients the implants can be placed above the chest wall muscle, that is in the subglandular plane. The disadvantage of using this plane is that in time, the breast implants may sag and may become a little wobbly. I personally use the latest technique of the breast augmentation procedure. Instead of putting the implant under the muscle, I put the implant under the fascia, which is known as the subfacial plane. So this fascia is a very thin layer which is present above the chest wall muscle. Now this technique provides two advantages. One, it provides adequate cover over the implant, therefore the edges of the implant are smoothened out. The other advantage is that whenever the chest wall muscle is contracted, the implant will not move, as it is not present under the muscle, but it is present under the fascia of the muscle. In certain selective cases, I also advise hybrid breast augmentation, particularly in women who are very slim. So in this technique, I harvest a little amount of fat from abdomen or thighs, process it, and then inject it in the subcutaneous tissue in the upper and the medial part of the breast. This helps in getting a smoother contours in the upper pole of the breast, a better transition and a very good cleavage. If you want a natural looking breast augmentation results, you can book your appointment. The number is given below. To see the other cosmetic surgery related videos, you can subscribe to our channel. If you have more queries, do write in to us. I'm also available in other platforms like Instagram and Facebook. Thank you.